today we are going to learn about a girl whose name was Florence Nightingale. As today we have doctors and scientists who are being a great help to us. Similarly, there was a time when the people were stuck with infections. So at that time, a lady I mean, a lady came out who helped everyone to save their lives. And she even sacrificed her own life to save the life of others. The name of that girl is Florence Nightingale. And her name was put on the place of birth. That means she was already born in Florence, Italy. So her name was based on the place of birth. She was born in 1820. She was a very good student. She was excelling in her studies as well. Now the story actually starts with that there is a man who's standing and he's standing in front of a statue and he's telling to his kids about this girl. So he starts with the Crimean War. There was a time in 1853 to 1856, there was a war called as Crimean War. Now in that war, many soldiers were dying. There were a lot of people who were dying. So everybody was confused as to what was the reason for their death. Is it the war or is it something else? Now, the man is remembering one incident that because he was hurt, he was injured, he was admitted to a hospital. So one day when he woke up, he saw a girl, a lady who was holding a lamp in her hand, and she came and very politely she asked, "How are you feeling?" So the old man said that for the first time, I felt as if somebody is respecting me. Somebody is actually helping the poor soldiers to treat. So now when this lady came, all the hospital people knew that she is a different girl. She has got some spark in herself. She is going to do something big. So the old man continues that she was a very strict nurse. She was a very strict lady. When she entered the hospital, she saw that there are so many people lying on the bed. There are so many unsanitary conditions. Unsanitary condition means the conditions which are bad. They are not hygienic at all. The bed sheets were dirty, the beds were dirty, everything was bad. So Florence, when she entered the hospital, she became very angry. She said, if you keep a hospital untidy, if you keep a hospital unclean, how is that possible? That the patients will recover. In that manner, patients can never recover. Patient cannot be healthy. They will always be affected by the diseases. So now she started working on the hospital. She started scolding the staff members. She took control of the entire hospital. But do you know that this same Florence, when she told her parents, when she was young, and she told her parents that she wanted to be a nurse, her parents disagreed. They never wanted Florence to be a nurse. Why? Because in her time, nurses were considered to be a bad job. Now, Florence's parents felt that if Florence is going to be a nurse, it is going to be a very, very bad job. So they never wanted Florence to work in a hospital. But later on, she convinced her parents, and in 1853, in the year 1853, she went to England to learn the process, like to learn how to become a nurse. In 1853, when she went there to train herself, she got to know about the Crimean War. It was then when she got to know that the condition of the soldiers is so bad. So what she did, she took her 38 nurses with herself and she went to the hospital. Now she was already shocked to see what is the condition of the hospital. So she complained to the government. She went to the government and she said, do you know the hospitals in your city are so bad? The condition of the hospital is so poor. So she made a proper report of it. And when she showed the report to the government was even shocked. So the government sent people to investigate. The government sent their officials to go and check what is the condition of hospitals in the city. So when the government officials entered the hospital, what very surprising thing they found, that the hospital was made on a sewage line, and the water that the hospital patients were drinking was of sewage. It was of a drain. That means they were drinking impure water. Now imagine somebody is giving you a dirty water. Many of the diseases like cholera and all, they are actually because of the contaminated water. So the main reason for the soldiers to fell sick was that they were drinking contaminated sewage water. Now, when the government official came to know, they also became surprised. So, Florence, along with her team, she started working on the hospital. She made the hospital clean, she made the bed sheets clean, she made a team, she made every hospital work and look good. Now, after that, what happened? Very soon, she was being treated as a hero. When she started doing such great deeds, she was treated as a hero. Everybody called her heroine, that okay, she is the leader for us because she has helped improve the healthcare conditions. It was because of Florence only that the healthcare conditions of England started improving. Because earlier the soldiers were dying, but now since the hospital was clean, it was sanitized. Now, what is the process? The soldiers were dying less. And even because of her great work, Queen Victoria approached her. Queen Victoria called her for a meeting. So she called her for a meeting so that they both can discuss about the future conditions. Like in future, how can we work together and improve the healthcare? Healthcare is like the medical facilities. So even the queen of that time, the Queen of England, Queen Victoria, called Florence to ask if they can work together and what new things can be introduced in the England. So this was her popularity. But on the same side, being so famous, Florence did not pay attention to anyone because she was a very simple girl and her work was to help people, to help the soldiers. She was a nurse and her entire attention was to help the soldiers. She never wanted to stop. And what happened as a result, when she was serving the people, like you must have heard so many news of so many people, like those who are treating the COVID patients, that some of them are dying because they were treating the patients. The doctors are falling sick. The people who are serving them, the nurses, even the scientists and the doctors who are in direct contact with the patients are contracting the virus and they are dying. Similarly, because Florence was working with the infectious people, she was working with the people who were infected. One day a very unfortunate thing happened, and what was that? It was the Florence herself got that bacteria and she fall ill. She was not healthy. She, her health started deteriorating day by day. On the very first day she was not well, but gradually her health condition started deteriorating more and more and more. Now what happened? This health did not stop her to do the things for the betterment of the country. She did not stop doing this work. Rather, she kept doing her good and noble deed for the soldiers of the country. And children, let me tell you, before Florence, no female was allowed to treat the British army. It was the Florence who was the first lady who was allowed to treat the army or the soldiers. So one day what happened? Trying and trying and trying, helping and helping and helping, her condition became deteriorated, and one day, unfortunately, she died. Now, imagine a lady sacrificed her own life for the betterment of the soldiers. And for the same reason, her statue was made in remembrance of her good work. It was made because she did so much of good work, and the story starts with the same thing. The story has also started with a statue. It was of Florence only, and the man who was standing is Mr. Andrews. He was the same man who was admitted in the hospital. So here we have the first thing. They are true and false. Now, as you can read here, mark these statements as true or false. The first one is the narrator was a soldier in the Crimean War. It's of course true because Mr. Andrews was the same person who was fighting in the war and was admitted in the hospital. The narrator met Florence Nightingale at a hospital in England. It is again true. The hospital where the narrator was taken was very clean. It is absolutely false because the hospital where Mr. Andrew was admitted was untidy. Parents were very excited that she decided to become a nurse. It is again false because Florence's parents never wanted her to be a nurse, as they did not find that profession to be good. There was a huge decrease in death after Florence cleaned up hospitals. It is absolutely true. Once the hospitals were sanitized, once the hospitals were clean, there was a decline in the death rate. Less number of soldiers were dying. Now these are answer these questions on page number 57. The first question is, who is the narrator of the story and how did they know Florence Nightingale? The narrator of the story is, of course, Mr. Andrews. And he knew Florence Nightingale because he was admitted in the same hospital. That is how she knew who was Florence. Who is the narrator telling the story to? The narrator is telling the story to his kids. In the starting of the chapter, we see a statue standing and Mr. Andrews standing and two children are standing beside him. So the narrator is telling the story to his children or his kids. What can the narrator still remember clearly after all those years? Now, there is one thing that the narrator still remembers today. What is it? It is the smell of the hospital and the environment. Mr. Andrews says that even after so many years, when I think back about that time, I can still remember the flies, the rats, and the smell of the hospital. How did the Florence talk to wounded soldiers? Florence spoke softly and made them feel respected. Like Florence was a sweet person. She always spoke very nicely and made the people feel respected. When did Florence know she was needed on the battlefield? Battlefield is simply treating the soldiers in the Crimean War. She was not fighting. Battlefield here refers to when was the time when she realized that the soldiers need her. So of course it was the Crimean War time when she was there in Germany for training. It was then the news of the Crimean War reached her and she thought that she should now help the people.